For more than a decade, Sylvia Bork had trouble sleeping. She says getting ready for bed was filled with anxiety.
I became very frantic because I was thinking, well, right away, wow, like night is coming again and I will see the ceiling for 3 or 4 hours.
Charles Morin of Laval University in Quebec, Canada, says there is more than one type of insomnia.
Some people can have trouble falling asleep at bedtime, others have problems with maintaining sleep, and still other people just wake up in the morning and they complain of not feeling refreshed.
Morin says finding a long-term treatment for insomnia has been difficult. Many patients become dependent on sleep medications and they can lose their effectiveness. So, Morin conducted a study of 160 adults with chronic insomnia. For the first 6 weeks, patients underwent treatment called cognitive behavioral therapy, which helps these patients relax. At the same time, they took a popular sleep medication called Zolpidem. Zolpidem is sold under the brand name Ambien in many parts of the world. Again, Charles Morin.
The most surprising finding was that when you treat insomnia with a combined approach using both CBT and medication, you might be tempted to continue this approach over the long term. But what we found here is that after a few weeks, it is best if you discontinue the medication and you just continue with CBT.
During the study, participants maintained a routine. Their time in bed was limited. They got up at the same time every day, periodically checked into sleep laboratory, and kept a diary. Behavioral therapy was extended for 6 months. Cognitive behavioral therapy still works for Sylvia Bork.
If you continue with medication, then people are less likely to invest time and efforts in changing their sleep habits.
Cognitive behavioral therapy still works for Sylvia Bork when she wakes up in the middle of the night.
The next day I will get up and I will be fresh again, and it's just my attitude changed.
The findings were published in the Journal of the American Medical Association. For reporter Melinda Smith, Ruth Reader, VOA News.